This video is brought to you by the University of Louisville's Compassion Clinic. Join us as we hear from members in our community discussing their vaccination experience.
Hi, my name is Monessa Cannon. I'm a first-year medical student at the University of Louisville.
Hello, my name is Sam Van Buskirk. I'm a first-year student at U of L School of Medicine.
Hi, my name is Jenny Chen. I'm a first-year med student here at Louisville.
What was your vaccination process like?
Well, I went to the drive-through vaccination clinic on Brook Street, and I scheduled my appointment online, and I drove up in my car. I had about a 3-minute wait, it wasn't long. I pulled up to a tent filled with a bunch of people, nurses and volunteers. They gave me a sheet just to fill out some basic questions about my health and who I was, my birthday, all that stuff. And then they gave me my vaccine. They just asked me to pull my jacket down. They put the shot right into my shoulder. And then they instructed me to pull forward into an empty parking space. I waited there for about 15 minutes and then I drove away. I never left my car. I was in there the whole time.
I got vaccinated through the university at the hospital auditorium. I scheduled a time online and then I walked in. They basically ask you for your name, sometimes your date of birth, and then they pull up your information to check that your appointment time is correct. And they give you a clinical form to fill out, and it just asks you what type of allergies you might have. It asks you if you've been vaccinated recently, if you have any history with COVID, and what that looked like if you have had COVID. It took about 2 minutes to fill out the form and then you give it back. It takes about 5 or 10 minutes.
I was fortunate enough to be vaccinated here in the School of Medicine. We had to check in at the computer. They checked us off, made sure that our appointment was at the correct time, on the correct day. They confirmed beforehand if we had had any previous injections, if we had any symptoms of COVID before our injection appointment, if we'd been in any contact with people, if we had any pending COVID results, right? This is all just to standard practice, just to make sure you're able to get the injections. We just popped it in my shoulder. And, you know, honestly, the injectors were so good that you can't feel anything when they do inject you.
They give you a little card that just has your name and what type of vaccine you got and just like what lot that came from. And it's just a vaccine record to say that you got vaccinated. And then you sit in the auditorium for like 15 minutes just to make sure you're not having any adverse reactions.
They check you out and they say, okay, come back in 2 weeks for your second shot. And then second shot, same process, except at the end they're like, all right, you're vaccinated.
Which vaccine did you get?
I got the Pfizer vaccine.
I got Pfizer.
So I got the Pfizer vaccine.
What were some of the side effects that you experienced after getting vaccinated, both the first and the second time?
So for the first vaccination, I didn't actually have many side effects, if any. Sure, the injection site was a little bit sore, but not to the point where I couldn't lift my arm or anything. And I had no other symptoms. I wasn't tired, I didn't have a fever, I didn't have anything after the first one.
The shot did not hurt. I didn't even feel the first one. The side effects were, one of the big side effects was it was a little painful where I got the injection, but the injection itself was not painful.
I think I was lucky with my side effects. For my first vaccine, I didn't really have any side effects. There was a little bit of tenderness, just like where I got pricked, but otherwise I was totally fine.
But my second shot did give me a little more side effects, which I hear is pretty common. All I had though was a day where I had a little bit of a fever, very mild, like a 99 to 100 degree fever. And I was really tired during that time, but honestly, I took some Tylenol, I slept it off. The next day, good as new.
With my second vaccine, I had a bit of soreness with my arm, so I couldn't lift my arm probably higher than my shoulder for 1 or 2 days afterwards. But other than that, I didn't have really any other fever or any other like body aches. So I think it went well.
The second shot, like for a lot of people, the side effects were a bit worse. I had a lot of chills after the second shot. Again, pain in the injection site. And it was over in about 24 hours. Then I didn't have any more side effects after that. I think the important thing to keep in mind is that if at any point you feel that something's wrong, if the side effects are lasting longer than you thought they would, anything like that, please don't hesitate to contact your primary care provider, any kind of person in healthcare. Even if all they say is that that's perfectly normal, you're okay, I think it's important that you get that reassurance and establish that contact to make sure that you're okay. You know your body better than anybody, so if you feel like something's wrong, please reach out to somebody and talk to them. And of course, if you think there's any kind of allergic reaction going on, if you feel like your life's in danger, please don't hesitate. Go see somebody immediately.
Do you have any tips for someone that is preparing to get vaccinated?
I think before you get vaccinated, just make sure that you haven't had any contact with people who potentially might have COVID, that you yourself don't have COVID, whether that means getting tested or just like quarantining for a little bit. And, make sure that you don't have any allergies that could be a problem if they inject you. And also make sure that you don't get any other vaccines before your COVID vaccination within the 2 weeks.
I would say just don't go in too nervous. The clinicians that are there are really there to help you, and they'll keep an eye on you and make sure you're doing okay. A tip that I did learn was if you just like relax your arm a little bit, which is hard to do, but instead of like tensing up, if you just release it and like keep it very relaxed, then it hurts less apparently, or you also get less soreness afterwards.
Wear something to where you can expose your shoulder easily. And I guess if you have had a bad allergic reaction to something like a flu shot or anything like that, make sure to let them know. That doesn't mean they're going to prevent you from getting the vaccine. They just need to know that in case something happens, because they want to make sure that you're safe and there's no horrible reaction that happens.
When you do get vaccinated, there is a program that you can sign up for, and a lot of the sites that you might get vaccinated at will tell you about the program. It's called VSafe, and the CDC basically asks you to register for the program, and it's a way for the CDC to keep track of all of your side effects. So when you get that app or when you register for that site, you just type in your side effects as you're having them, and then if there's anything serious, the CDC can track you down, but also can use those side effects and like monitor those side effects across like the larger population to keep everyone safe.
Do you have any final remarks?
I think, everyone should go get vaccinated.
I think the big thing is just to go get vaccinated. Tell your family, tell your friends. That's really important to kind of returning to like a normal and healthy lifestyle. Just go get vaccinated.
Hey, go get vaccinated as soon as you can. I think the best thing to come from it is peace of mind, and you're protecting yourselves as well as people around you. So go get vaccinated.
This video was brought to you by the University of Louisville's Compassion Clinic. For more information regarding the COVID-19 vaccine, please visit our website, which is ulcompassionclinic.org. Again, that is ulcompassionclinic.org. Thank you so much for your time.